Hello everyone, my name is Tal McChesney, and in today's presentation we will be discussing healthcare laws and reform. The three healthcare reform laws that we'll be discussing more closely will cover the topics of minimum wage, immunizations, and violence in the workplace. In 1938, the Fair Labor Standards Act, or FLSA, was passed to govern a fair minimum wage to American workers, time and a half pay for those who work over 40 hours, and oppressive child labor laws. Immunizations for healthcare workers has become a hot topic over the last few years. While currently there is no federal law mandating that healthcare workers need immunizations to do their job, it has been left up to the state and local level to decide whether immunizations are required or not. Creating a safe work environment for both the healthcare worker and the patients that they serve has been on the forefront of administration, education, and policy. Now we are going to dive deeper into each law and the necessary reforms. In 2018, the Department of Labor provided clarification regarding the employer status of home care, visiting nurses, and caregiver registries. A recent reform in the arena of mandated immunizations for healthcare employees provided more specific qualifications for religious exemptions. For example, a recent federal district court ruled that a vegan lifestyle could be defined as a religion and therefore a justifiable cause for immunization exemption. In 2018, the Joint Commission, or JCAHO, advised healthcare organizations to implement measures to address workplace violence. This is a reform that is monitored by both the state and federal level. It outlines 7 steps an organization should take to prevent workplace violence. The first step is to clearly define the workplace violence and put reporting systems into place. Second, recognize the multiple sources of data and capture, track, and trend all reports. Third, provide appropriate support and follow-up for the affected. Fourth, review and analyze the related data. Fifth, revamp systems that are already in place. Sixth, train all staff. And finally, evaluate your initiatives. This next section will summarize my interview with my own human resources manager, Ariane Randolph. My first question to Ariane was, now that PPRH has become part of UC Health organization, how has your job changed, if at all, considering PRN employees who have worked multiple facilities under the UC Health umbrella? For example, what benefits or challenges have you experienced since this change? In short, Ariane happily shared this merger has afforded her more responsibilities, particularly surrounding employee tracking. Additionally, she feels that the boundaries of her job are more clearly defined, which in turn has reduced her responsibilities after hours. The greatest benefit of the merger has been having access to a larger employee pool with more qualified PRN workers. My next question for Ariane stated, given the ongoing discussions at the federal level regarding required employee vaccinations in the healthcare industry, what changes have you experienced, if any, regarding personnel, medical, or religious exemptions for required vaccinations? For example, have you seen an increase or decrease in employees asking for waivers from the flu vaccine? To this question, Ariane stated the most common request for a vaccine waiver has been for the flu. An annual flu vaccine is currently the only mandated vaccine within the organization. Waivers are issued with an appropriate medical or religious documentation. However, most waivers issued are for medical reasons. The recent measles outbreak, however, has inspired more discussion on this topic. My third and final question for Ariane stated that workplace violence has become a hot topic for discussion, particularly in the healthcare industry. How have you been involved in the discussion, planning, training, and assessment of violence prevention? Ariane, in short, responded to this with, due to the increasing discussion and more so concern regarding workplace violence, planning begins at the higher organization level and the HR managers are brought in at the implementation phase of the process. Thanks everyone for listening. I hope you all learned something from this presentation. I know I sure did. A list of my references can be found on the next 2 slides.